you have the medical side of things with Dr. Paul, where he's walking you through what is going on from a metabolic side. And, that doesn't necessarily resonate with everybody. I couldn't tell you going into this program what a good fasting blood sugar number was. I knew, roughly what was good, what was bad. I mean, I have diabetes in the family, so I was vaguely familiar with that. And the same thing goes with cholesterol levels. I mean, we all have our professions and other things. And so it was wonderful to have him by your side every month, watching, walking you through what you're doing and how that is going to impact, and then having the baseline blood work and also the checkpoints down the road to see your comparisons and see what you're actually doing. So it was just a couple of weeks ago that I hit 255, which I haven't seen in 6 years. We got at the end of the program, the 6 months, we ran blood sample again, and there was just remarkable change there too, where blood lipids are down, cholesterol was way down, and fasting blood sugar was down, A1C is down, you name it, it improved. So that's kind of my story, and that's how I got here today.
Hello, everyone. Welcome to episode 6 of Reimagine Wellness. I am one of your hosts, Ryan Dominguez, joined alongside my co-host, Mike Rossi. And we are so excited to present to you our episode 6 of Reimagine Wellness. This is going to be a new format compared to some of our prior podcast episodes, where we're going to be having Patrick Mulhearn here, just a former college athlete, participated at the highest levels of football, and has an interesting metabolic journey that he's gone through of both ups and downs. And he was enabled on this journey via the help of friend of the show, Dr. Paul, who's joining us here today, who will be able to fill in any details, any of the nitty gritty regarding the recommendations that he made and what's been impactful about having Patrick as a client. So with that, welcome, Patrick. Welcome, Dr. Paul, once more. And we're really looking forward to starting. So I think the most obvious place where we can start today is just introducing yourself, Patrick, and telling us a little bit about your journey.
All right. Well, thanks for having me on, guys. So I am 35 years old. I live with my wife and in northern Indiana. And my health and wellness journey has been a lifelong challenge for me. I've always been the heavy kid growing up, but I was, as you said, an athlete, and I had always used sports as a way to manage my weight and to really just, that was my favorite thing in the world to do. And over the course of time, as I was getting into high school, I really started playing football at a higher level, and my weight was no longer an issue. And went through high school and into college, played a little bit in college, and moved on into real life as an accountant. And my health started becoming an issue, because instead of going to practice every day, running and lifting, I was sitting behind a desk all day. I'm, as a public accountant and now in private industry, there's just isn't the time to be in the gym or out running that I used to have. And I'm not playing competitively pretty much in anything anymore. So over the course of the last 15 years since college, I have progressively gotten into worse shape and gained weight bit by bit. I always go back to, in high school, my playing weight was about 185, and in college I was at 205, and I'm about 6'2", so I have a pretty decent build. But over the course of the last 10 years, I've slowly inched my way up, and was at 265 pounds when I got married in 2021. And about a year ago today, really, I hit my all-time high, and I crossed that threshold that I never wanted to cross. And I weighed in at 306 pounds, and I just knew something had to be done. And so I started looking around. I saw my own doctor and got the typical advice of, oh, it's just diet and exercise, and you'll be able to take care of this. And I've done a lot over the last however long, with that athletic sense. You always want a challenge. You always can beat it. Whether and you name the diet, I tried it. You name the workout fad, the DVDs, the CrossFit, I've done it, and it's to varying levels of success. So really since 2018, I've yo-yoed between 260, and then I lost 30 pounds, and then I gained it all back. And pre-COVID, or during the heart of COVID, I hit 285 and then lost 25 pounds for my wedding, and then gained it all back and more afterwards. And it just, diet and exercise wasn't it for me. I couldn't count calories. It just wasn't a sustainable lifestyle for me. So it was, again, about a year ago that I started looking more in depth for help. I knew that if this was going to work, I was going to need something more than just diet and exercise. And that's why I went originally to my doctor, and then decided to continue looking, and on a whim kind of was searching Spotify for a podcast to listen to about the new weight loss drugs that had entered the market, because I had seen friends who had significant weight loss with those. And as I'm driving to and from work, I was working in Alabama at the time, so I had a nice long 10-hour drive. I came across Dr. Paul's podcast, and it was kind of cool. I had had success in the past with low carb dieting, and I had seen a couple of professional athletes who had used the continuous glucose monitor that he uses in his practice. And being an accountant, I'm a big data guy. So that was kind of cool. I was like, okay, I have something here that I could possibly use and have the data hit me in the face of what's going on. And it didn't hurt that he and I went to the same undergraduate. I think we all did. And so I decided to give his practice a call. I believe Dr. Paul was in May of last year, May or June.
Yeah.
I reached out and I reached out to the Metabolic MD practice. And thankfully, Indiana is one of the states he covers through his practice. I believe it's Ohio, Indiana, Arizona, and Florida.
Yep.
And so thankfully I live in one of the states. So it's like everything kind of just all came into play at the same time. Reached out to his practice, and after listening to several of his podcasts, it was really cool. He does the actual intake interview. So, I'm listening to a guy on a podcast for, weeks at a time, and then you get to talk to him was really kind of a cool thing. And so we spent a good hour on an intake, and I decided that to start his program, that would have been in June of last year. So we did our 2-week intake where he put me on the continuous glucose monitor for the whole 2-week period, but instructed me not to change my diet at all, just to kind of get an idea of what life was doing to me and how it was impacting my blood sugar. And at the same time, he had me get labs taken to take a look at my insulin resistance, my fasting blood sugar, blood lipids, et cetera, just to kind of see where things were metabolically at that point. And also, if we decided to go on with the program, have a baseline. So we did all that. And over the course of the 2 weeks, I kind of lived my life. I had the foods. I told my wife at the time, we're going to play the greatest hits. I'm going to have the foods that I love and see what it does, and see which ones are the ones that got me to the point of hitting 306 pounds. And it was absolutely eye-opening, and really, really made me think about what I was doing to my body every time I had my favorite food. I kind of laughed when driving to and from work, I bought a bag of gummy bears just because, that was a childhood favorite, and watched my blood sugar shoot up to over 200, and had my favorite Thai pad Thai meal, and watched it go into the 180s, 190s. And it's just like those are things you don't think about. It's simple but you're just the damage you're doing to yourself. And I finally realized that. So at the end of the 2 weeks, Dr. Paul and I sat down and kind of had some sobering news on top of that, that my blood lipids weren't doing so great. My cholesterol was high for my age, and I was definitely pre-diabetic, and insulin resistance was pretty significant. So it was then I decided to jump into his program. So starting actually July 1st, I took on his program full on. So it was a 6-month commitment to wearing a continuous glucose monitor every day and following a strict low carb diet, which he prescribed to me. And then what's the coolest part about his practice is that it's not only a medically guided diet where you have an expert in the medicine field, but also he has a partner in Rhett Clark, who is a nutritionist and personal trainer. So each month I had a visit with Dr. Paul to kind of keep things going and monitor carb levels, et cetera, and see how I was doing physically. But also every other week, Rhett was on the phone with me, pumping me up and making sure that, all right, how are you doing? How are things going? How are you feeling? What can we do? How are you sleeping? I mean, he was just on top of me, just really making sure that I wasn't losing track. And so it was the program just really worked for me. And another key part of the program, which for me as a big eater, is that he has us get a subscription through his practice to the Chronometer app. And one of the big things, and Dr. Paul, you can attest to the importance of being really strict on the carbs, is that you have to measure out everything. So I became really close friends with the food scale over the course of that 6-month period, and watched my carbs like a hawk, and really over the course of those few months started to see some solid progress, and not only in my weight going down, but also in improved cardio as I was working out more. And also the big part of the program is strength training. So I was able to see some pretty significant increases, which after a long period of being off weightlifting from being an athlete in high school and into college, was a welcome change. So really, that's kind of the way that the original program started and went through for the first 6 months. And that got me through the new year. And we are now in the middle of the second part of the program, where it's back with the glucose monitor, but a little less frequent contact with Dr. Paul, but still following the same everything. And the results speak for themselves. So over the course of the last 10 months now, I'm down 50 pounds. So it was just a couple of weeks ago that I hit 255, which I haven't seen in 6 years. And Dr. Paul can attest to this too. We got at the end of the program, the 6 months, we ran blood sample again, and there was just remarkable change there too, where blood lipids are down, cholesterol was way down, and fasting blood sugar was down, A1C is down, you name it, it improved. So that's kind of my story, and that's how I got here today. And I just really, really couldn't thank Dr. Paul enough for putting me on this program.
Great. Thank you so much for sharing your story. And to start off with the questions, I guess I'm curious, you talked about past efforts to do somewhat similar things to bring about a change in your life. And Dr. Paul's program has been especially effective. I know you're an athlete at a high level, and I'm sure coaching is something that resonates well with you. And that's something that I heard come out a little bit in your description of his practice, is just those touch points, making sure they stay on top of you and that they think about you as more than just a simple patient, perhaps, but as a partner in this journey. Could you talk about maybe some of the key differences between Dr. Paul's practice that you believe were instrumental in making this change?
I think the biggest thing is that it's the two-pronged approach. You have the medical side of things with Dr. Paul, where he's walking you through what is going on from a metabolic side. And, that doesn't necessarily resonate with everybody. Um, I couldn't tell you going into this program what a good fasting blood sugar number was. I knew, roughly what was good, what was bad. I mean, I have diabetes in the family, so I was vaguely familiar with that. And the same thing goes with cholesterol levels. I mean, we all have our professions and other things. Um, and so it was wonderful to have him by your side every month, watching, walking you through what you're doing and how that is going to impact, and then having the baseline blood work and also the checkpoints down the road to see your comparisons and see what you're actually doing. But also from outside of the medical side, to have the nutritionist and the personal trainer to bounce ideas off of, and that was an every other week situation. So you couldn't really get too far off the rails if something was wrong. And one of the cool parts of the practice is that both Dr. Paul and Rhett are always available. So whether it's through the portal of his practice runs, you can send an email. Like, I had a couple of issues with my glucose monitors, and I tend to, when things go wrong, and I think a lot of people do, when things go wrong, you kind of stop what you're doing and lose focus. But he responded to me personally through the portal within 24 hours. And then Rhett, if I had questions about anything, I would text him and he would text back almost immediately. So that was just instrumental in keeping me going when, early on, it's not, the low carb diet is not difficult to always have food, but it can be a struggle to change the lifestyle. And I know that's the biggest thing Dr. Paul and Rhett talked about, is that this isn't just a diet. This isn't anything short term. This is a lifestyle change. So I think that the dual approach really was a good thing. And also working with Dr. Paul, one of the cool things is that he, like last year, he put out a book, and I've got it right here. So I've had this on my nightstand for the last 10 months and I was just reading it on spring break when things were going a little sideways, but I've kept it with me just to keep reminding myself that the tenets of the program, and, it's not linear, but that's the support that he and Rhett have provided through the whole thing that really made the difference between trying to white knuckle it on my own and then having a team supporting me.
That's great. Yeah, and definitely contrasts with some of the transactional approaches that we see in healthcare nowadays. I have the same sort of question for you, Dr. Paul, as well, which is, there's varying willingness to evoke changes in patients. And a lot of times the mindset that a patient approaches the journey can make all the difference. Can you talk a little bit about Patrick's mindset and maybe how he set himself up for success with your program?
Yeah, I think Patrick came in motivated, but I'll tell you that the CGMs are a big part of that. Yeah, you can hear your doctor say, lose weight, exercise more. You can know that you're, pre-diabetic or heading toward pre-diabetes, but when you see the numbers on your phone, when you see the spikes and the drops, that facilitates change. I mean, people seem to understand for the first time. It's why I wrote the book. They seem to understand that this is real and I need to do something. And I think that motivates individuals to move in the direction Patrick has. And I want to compliment him because he bought in on the whole concept and did everything the way it needs to be done. And I want to mention that Patrick lost 50 pounds without the new craze in medications. He has done this the old-fashioned way. And those medications might have their place for people that get stalled occasionally, and I do that, but he has done it the way I've been doing it for 7 years before these medications became popular. And I think the CGMs are just critical, because when you see the data, it motivates you to make change, and not just like change while you're looking at the data, but lifetime changes. So I want to congratulate Patrick on his accomplishments.
Patrick, I've got a quick question about
Sure.
the continuous glucose monitor. You mentioned that you stopped and got some gummy bears, and then watched, the glucose monitor skyrocket to 200.
Yeah.
I think a lot of people aren't going to be surprised that gummy bears, spike your glucose. But did you notice like any kind of surprising foods that spiked your glucose? Maybe even some foods that like are marketed or generally accepted as healthy, that maybe for you, the continuous glucose monitor kind of confirmed to you that that's not the case.
Yeah, I did. And I think the gummy bears was just kind of one of those fun experiments just to see what was going on. And it's an immediate feedback. Within a half hour, you can tell whether something is being impacted in your system, or is impacting your system. Um, and this is an area where I actually had a couple of long conversations with Dr. Paul and Rhett, is that there are a lot of products that are marketed as keto or low carb or something that may or may not actually increase your blood sugar. So I've cycled through probably 6 different keto breads over the course of the last year. And early on, it was hard to find anything. And that's one of my real trigger foods. So having bread's not a great idea, but also going away from it, where you go to a restaurant and you eat the whole the basket of bread. Uh, I really wanted to have something where I could have it in moderation. And but that was one thing where there were a couple of brands that I tried where tortillas, they're marketed as zero carb or low carb or keto friendly. And I'd sit there and it's spiking me over, I try to keep it now under 125 after any meal. And originally it was try to keep the spikes under 150. And there was certain times where you'd have a couple pieces of bread in a sandwich, and it was just like, and it was like lunch meat. So there wasn't any sugar. I made sure there was no sugar in that, and it would just jump and for no reason. So yeah, I mean, that's a really good question, is that it's not necessarily the marketing, the way that your blood sugar responds isn't necessarily going to be consistent with how it's marketed, or even the carb or net carb levels. Sometimes it seems that your system responds differently to different things.
Yeah, sticking with the diet conversation for a little bit here, I would assume gummy bears weren't, a core part of your diet, but would be curious to hear just sort of what like a typical meal looked like before working with Dr. Paul, and sort of maybe like, yeah, a home cooked meal essentially. Like what components does it consist of? What are you trying to plate out in terms of proportions?
Sure. I mean, I was, being from Chicago, pizza was a main staple of my diet growing up and through college, and pizza, pasta, you name it, all the fun. I love Italian food. So that was really, and as Dr. Paul talks about in his book, it's the standard American diet. I wasn't huge into fast food, but I did dabble more than I should have. But ever since getting onto the program, I've leaned pretty heavily into, obviously with a heavy restriction on the carbs. My plate now is pretty heavy protein. So I try to stick with, leaner proteins for the most part, but also leaning into a good steak every once in a while, as Dr. Paul would say, to keep those healthy fats to help stay satiated. But it's really kind of like half protein and then vegetables, a small amount of fruit. And my wife and I have really focused on staying at home and eating at home, like you said, because you can measure and manage everything that way. But it's, again, as I said, I've become very close friends with the food scale. We have an island in our kitchen, and the food scale sits in the middle of the island because I'm measuring everything as it goes. Dinners are a little bit more free flowing, but the protein for sure, and any carb that's on the plate, I really want to make sure I have it. And it's not going by the labels with tablespoons or anything like that. It's all grams. It's just straight weight, because that's so much easier to actually know what you're doing. And then as we're sitting there, I log my food right away. So I'll scan, take out my phone, the app, the chronometer app, and I scan it and get it in right away. And I've noticed over the course of time that there are certain foods, by doing that were staples. Like, I love a good peanut butter and jelly sandwich. Can't do the jelly, and peanut butter is just a wreck for this, because it's marketed as being high protein, but it's really not. It's much higher calorie, and then it's something that really, you look at it and you think you're putting yourself one serving, and it's 3 before you know it. So I know I got a little bit off track there, and then one of the biggest things that I've done, as far as like we have sectioned out meal plan containers that I use for lunch every day. And I weigh out the protein and weigh out the vegetables, and stick pretty much to that, especially when we're really, really, really strict. So.
Hey, can I interject a couple things? First of all, Patrick, incredibly disciplined, but also, we realize people have to live their lives. And so, if he goes on vacation, he's going to have a good time with his family, maybe eat some things that he wouldn't otherwise, but he's always going to come back home in terms of this structure. The other thing I want to point out, which I see with a lot of my patients, is, so Patrick has gone on this lower carb, higher fat diet, because lower carbs are necessarily higher in fat. They just are going to be. You heard him mention steak, and we talked about good fats and bad fats. But so looking at his numbers, and I wanted to mention this. So obviously he dropped his blood glucose. He dropped his A1C. Fasting insulin is a critical number here. I do that on all my patients. He dropped his fasting insulin level over 25%. But really what's interesting is he's goes on this lower carb, higher fat diet, and his cholesterol goes from 198 to 170. His LDL, which is the bad cholesterol, also drops about 15 points. And then remarkably, his triglycerides drop from 182. Triglycerides are another type of fat in your blood, from 182 to 119. And that's because triglycerides are formed from the conversion of blood glucose to fat in the liver, which, you don't think of intuitively. You think if you eat more fat, your triglycerides are going to go up, but the opposite actually happens. And I see that with just a lot of my patients. So, cholesterol has been public enemy number one over the last 50 years. During a time where we turned our diet to carbs, and that generated epidemics of obesity and diabetes. But Patrick, by following this program, has actually not only lowered his insulin resistance, but he's improved his lipid profile as well. So I just wanted to interject that as we talk about the type of foods you've gravitated toward, Patrick, because your numbers have improved dramatically as well.
Dr. Paul, from what I know, or from what people tell me, I should say, eating more saturated fat typically increases LDL. What would be the mechanism behind the drop in the LDL for Patrick?
I think it's just that he's eating whole foods. He's eating higher quality foods. He's staying away from seed oils. Seed oils, corn oil, soybean oil, all in processed foods. 70% of the food we eat are processed foods. They all have seed oils in them. Fast foods have seed oils in them. And when he really turns to higher quality fats, like the higher quality saturated fat in a steak, and though it's more expensive, if you can get range-fed meats, that's going to help because they're higher in omega-3s as opposed to omega-6s. But just getting away from seed oils can result in a lot of this change.
Yeah, that's great. And Patrick, I heard you also mention you eat a little bit of fruit. Um, wh- I'm curious because I've heard a lot of different perspectives on wearing a continuous glucose monitor and kind of testing out fruit. Have you
Mhm.
noticed that there are certain fruits that are no-goes and other fruits that work for you? Or is it more of like as long as I don't eat too much, I don't get too much of a glucose spike? How does that kind of work for you?
Yeah, I mean, from Jump Street, I was always stick to the berries. Um, that was from talking to Rhett, it was blueberries, blackberries, raspberries, strawberries, and beyond that, most everything I haven't even tried. Like I know bananas for sure would shoot me through the moon. It just so I've really stuck heavily that just within the berries, and that's enough for me. I always liked those anyway, so it wasn't really a ton. Um, so that's kind of where I've stuck.
Awesome. And I know obviously it seems like the two big pillars of Dr. Paul's practice are, you know, low carb and strength training. And then you also sprinkle in the GLP-1 medications as well. In your case, that wasn't necessary. So congratulations, you're able to do, this kind of massive weight loss and health transformation without any drugs, which is always great. Um, what what about any other lifestyle interventions? How about something like fasting? Did you implement any sort of fasting regimen as part of your health journey so far?
Yes, that was actually one of the first things that Dr. Paul and I talked about at the beginning of the program was to kind of over the course of time build in an intermittent fasting routine. And he didn't want me starting just absolute, one meal a day type stuff. I know people go crazy with. So early on in the program, it was just try not to eat before noon, about 12 hours on, 12 hours off type of deal. And throughout the course of last summer and into the fall, I accelerated pretty quickly. And then during the weeks, I tried to have an 8-hour eating window. So I would usually don't eat breakfast and um, try to be done by about 8 p.m. with dinner. So it's like a 16-8 roughly. And then every once in a while, I would throw in, I called them a fasting Friday, where I would see how far I could go during the day and try to go from dinner Thursday to dinner Friday and have a nice little 24-hour fast to start the weekend off right and also provide a little bit of variability. But I think that especially for someone who like myself struggles with um, overeating, that was a way to really limit the amount you can eat because there's especially when you're eating a diet like the low carb, higher fat, there's only so much you can eat within that window. So it really helped me stick to a calorie total without actually having to measure calories or stick to a prescribed number. We always had a number in mind, but it wasn't something where I had to be on 1,500 calories to lose the weight quick. It was we were roughly between 2,000 and 2,200 calories as a guideline, but it could go up and down. But it was really hard to get there with the way that the diet is structured and only having about 8 hours or less to eat during the day. So I think that was a big part of being able to get things going, especially early on when you're trying to establish a new lifestyle.
Continuing on this topic, at metabolichealth.com, we have 6 lifestyle levers that one can employ in order to optimize their metabolic health. And we touched on a couple of them already. And I know, Patrick, at the beginning of before the call started, we talked a little bit about sleep and the impact that could make, and how Rhett has been guiding you along that journey. Would love to hear a little bit more detail about those recommendations, how many of them are to be implemented versus currently implemented, and just your understanding of that change that you're trying to make.
Sure. Yeah, that was going into the second half of the program. So the next 6 months, the first discussion with Rhett was where we're going from the beginning. We've gotten through the, the quote, easy part of the program. And now, after the first 50 pounds, the weight isn't going to come off as easily as it did before. So as you said, sleep is one of the areas that he and I talked about working on. And ever since COVID, I've worn a Whoop strap. So I track my sleep on a daily basis just to make sure I'm getting enough sleep, and just I can just tell the difference when I'm not getting enough sleep. And we talked about in the last call we had that not only is it just being rested and recovered for the day, but it helps you make better decisions when you're rested and when you've slept well. So it's been very interesting to see. You can kind of correlate some of the bad days that I've had throughout the whole process, or when my sleep number or my recovery score is low. So that's one, as you said, a big area that we're trying to work on. And then another thing that we're working on is just different approaches to strength training. And we kind of wanted a goal setting beyond just a number on the scale. So I'm running a 5K here at the end of April and a 10K at the end of May. Just to have a little bit, because not only is there the strength training portion, but Dr. Paul makes sure that you're getting in the recommended amount of cardio too, while not getting too much, but enough to meet the guidelines and keep you moving. And Rhett has had me on a step goal for a daily step goal from the start too. So that's helped keep me moving. But that's kind of the transformation from stage one of the program to stage two, is getting a little bit more targeted with goals and fine tuning some of the other, as you call them, the other levers that we've got.
Yeah, I'd be curious to hear what some of the strategies are for optimizing sleep that you've been employing. I would assume it's not, enjoying a bottle of Ambien before you go to sleep. But are there perhaps more natural methods that you've been using in order to optimize your sleep? We've heard in other podcasts, blue light blocking glasses as one tool you could implement in order to reduce the screen exposure that you're getting. I know that's probably a concern with the work that you do. So be curious about some of the tools maybe that you're employing to help with the sleep.
Yeah, I haven't gone that far with the blue light blocking glasses. We try, my wife and I try to have a shutdown time, because one of the big parts of the Whoop app is it looks at the time you go to sleep every day and consistency with getting your circadian rhythms in the right order. So we've tried to do that, and again, that's hard when she's a teacher and they're up late scheduling people, and I'm with my job, it's hit or miss there, plus travel. But it's doing that. It's cell phones, trying our best to not be scrolling on social media as we're going to bed, turning the lights down a little bit after about 9 o'clock. But it's consistent sleep time, trying to get a consistent wake time. Room temperature, I try to keep the room a little bit cooler, because I know that helps with sleep. And one of the big things as part of the program with limiting carbs is I've pretty much cut out drinking at all. And because that's one area that I noticed that, it's definitely a myth that having a nice drink before you go to bed helps you sleep, because the quality of sleep that I noticed, even with just one 12-ounce drink or 12-ounce beer, it's horrible. And so that's one thing that I think has been a pretty sustainable impact on my quality of sleep, was just kind of cutting that. And I was never a heavy drinker, but just cutting that out, or not having that glass of wine before bed or with dinner, really.
How about stress? I mean, obviously, elevated weight, there are hormonal aspects to that, which can be driven by stress with increased cortisol and things like that. How was your stress level before kind of the interventions with Dr. Paul? And like, where would you say it is now? And kind of, what interventions have you implemented to get there?
My stress levels have kind of gone up and down. I worked in public accounting, so that was long hours, bad food, and just high pressure environment. So I left public accounting to avoid some of the stress, but just the daily job is just enough stress, and life is hard. So we go through a lot of stuff every day that gets there. I've found that one of the best ways to deal with stress is activity, and it's jumping on the bike or going for a run, even going for a nice walk. Weightlifting certainly helps, just to kind of blow off steam. But um, so those have been kind of productive ways to manage stress. Um, just getting up from the desk and walking around the office, going outside, taking a deep breath, going for walks at lunch with coworkers, so that you're not glued to the computer all day. Just not letting it overtake you, but um, and I've noticed that significantly helps with mood, and with, again, similar to sleep, it helps with choices too, because being an overeater, there was a certain portion of that was attributable to being an emotional eater, and I dealt with stress by eating. That was, it made me feel better to have a Reese's cup at lunch, or after lunch in the afternoons, or whatever, silly stuff like that. But or would have just a big dinner, and we'd order pizza instead of cooking it at home, because that just felt better. So reducing stress relatively, and then also kind of understanding the decisions that come with it, and trying not to cope, has been a big deal as well.
You mentioned travel, and kind of leaving public accounting to kind of avoid some of the stress. I assume that's been beneficial to you from a diet perspective too, because obviously eating on the road can be challenging sometimes. Do you ever have to travel now for work? And if so, like, do you have some kind of way to manage travel, to stick to your diet and all of the other things that you've been doing?
For work, I actually did a 18-month kind of a rotation within our company, and so I was traveling for a week out of every month, driving 10 and a half hours south to Alabama, working at one of our companies, and staying in hotels, not cooking meals. And that was a huge issue as far as the quality of the foods, and trying to avoid the seed oils, like Dr. Paul was saying, is virtually impossible, let alone in a small town in Alabama, where you're away from um, supermarkets. And so actually, one of the ways that I did with that towards the end, and this is something I talked about with Dr. Paul and Rhett, was, instead of staying at a hotel, I tried to find a place that I could rent with a kitchen. So as I was starting the program in July, I did that for the last 2 trips, and it made a significant difference. And so that's one strategy that we put in. But another thing is that, living in Indiana, my wife and my families are in Pennsylvania and in Illinois, so we're on the road a lot to visit family, and that includes stopping on the toll road for a Burger King or what have you, because as we all know, there's limited options when you're traveling. So we started packing food when we go, and making sure that it's, for me, I have my low carb stuff. I'm not, no liquid calories. So it's either a zero something, or a diet something, or a lot more water, which is a change. But that with travel, it's prep. And I would do the same thing when I would driving 10 and a half hours. I'd have my food in the car. Occasionally I would stop for something and eat a burger without a bun or what have you. But it all comes down to being prepared, and not trying to wing it as you go, because that's when bad decisions happen.
And it sounds like, you lighten up a little bit when you go on vacation. You kind of allow for the fact that you're going to be with your family, you're going to be going to restaurants, and some of it's unavoidable, and some of it maybe you just kind of loosen up for a week or so.
Yeah. One of the first things that we had, life events happen, and we had a death in the family, and my wife's family is Italian, so those events are always surrounded by food and awesome food. So we had to travel up to Canada for that, and that was the first time. So that was in mid-October. That was essentially the first time I cheated, and I admitted it to Dr. Paul, and had,
I've absolved you of your sins.
served my penance. But that was the first time. But one of the good things I noticed is that, like, that was okay. It got me out of my rhythm, but I was able to recover. And again, I've got his book, like, reading going back through that stuff when I need it, like, it just having having that every other week meeting with Rhett and telling him, like, okay, this is probably not going to go well. And it's okay. You've done so well. It's fine. Having that support through it, I was able to get back on. And then the same thing happened with Christmas. And again, with family that provides love via food, that I didn't go crazy eating cookies, but, I didn't stop myself from enjoying the meal that, my mother or my mother-in-law provided. And it didn't feel guilt about it, because, those things happen, and without enjoying that time with family, the program isn't worth anything, because the whole idea is to improve your life so that you can spend time with family. And if it's not, and it allows you to be flexible on that end, and you just jump right back on it. And again, we just got back from a week on vacation this past week, and my wife and I and a couple of friends traveled, and we had a good time. And, I monitored, I wore the CGM the whole time, and I saw, and it reinforced. And so, you have a couple slices of pizza, and you see what it does to you. And it's like, okay, I'm not going to get too upset, but I'm not going to do this at home. And we kept saying this, is that it's like, okay, this is a vacation food. It's not a lifetime, this is not our lifestyle anymore. And granting ourselves a little bit of grace. And, I got home on Saturday, meal prepped on Sunday, and we're off. We're back on the plan, and, the negative impacts of the travel are going to go away.
Yep, social connection is definitely something that we emphasize as well, as critical for the journey, both for stress management and, you mentioned in many instances, support. I'd love to dig in a little bit there and understand more the support and partnership of your wife in particular, and then maybe even more broadly than that, like anyone else in your family who maybe has seen the transformation in you and wants to try something similar.
Yeah, my wife has been unbelievable through this whole process. She is a college athlete as well. She played Division III tennis. So this whole concept of being disciplined and hard work is not something that's foreign to her. So, and she's actually kind of done a soft version of my weight, and she had lost weight up until she's 6 months pregnant now. So things have kind of changed a little bit here over the last 6 months, obviously. But she has just, it's asking me, what can we eat? What can I make you? Going through the grocery store and spending a little more time with me to read the labels and understanding what has the, where the carbs are, avoiding those. And one of the really interesting things is, as we were deciding to start our family, the concept of avoiding seed oils came up in her research as well. So that's something she reads every label down to the oils that are being used. And again, that's something that, talking to Dr. Paul throughout, he's given me guidance on as well with her. Just kind of, as a partner, how can you help her to help you? And that's just been so cool. And so she's been very instrumental. And my dad has been awesome through everything too, because he's fought the same battle with diabetes, and he beat it through diet and hard work himself, like 15, 20 years ago. And so he's been very supportive and pointing out the good decisions I'm making and progress that I've made. My in-laws have been great. My mom has been great. My sisters have been really cool about things. And it's been really fun getting texts from, it was just this week again, getting texts from both my sisters asking questions is like, hey, what do you do as far as your protein to carb ratio, or what foods at Costco can I get, and we're sending pictures of good stuff that we see, because they're back in Chicago, and they're both seeing positive results from adapting a very similar lifestyle without necessarily being on the program, but just the way that goes. And again, I bought the book for my dad, so my family has a copy too, because he's looking at ways to continue his journey of trying not to fall back into the patterns that had landed in type 2. And so it's just been the whole family has been very supportive. And as I mentioned, I'm going to be running races here over the next couple months, and I'm running one with a brother-in-law on each side of the family. So my wife's brother and I are running in May, and then my sister's husband and I are running in June. So it's getting support across the hall from everybody. So it's just been awesome.
Yeah, I love to hear that. Just it's interesting to see also how what you have learned, you've been able to scale to others. And we see that as a critical part of social connection as well, is that we used to have this system of wisdom and reinforcement of good behaviors and understanding naturally what was good for us and what would promote a good life. And you're able to act as a small cog in your family through which to radiate that change. So love to see it.
Dr. Paul, I'm interested in how typical is Patrick as a patient in your practice? Obviously, you deal with a lot of different folks. I think you mentioned once that primarily, probably over 50% of your patients are women, which some people find surprising. But how typical, when you talk about Patrick, 35 years old, pre-diabetic, elevated weight, right? A number of different issues there: high cholesterol, high fasting insulin, high blood glucose. Is he kind of like the typical patient that you see? Is he a little bit different? What would you say there?
Well, I think Patrick's been very disciplined, but I have lots of patients that, again, once they see the data, are very disciplined. He's a male, and in fact, the majority of my patients are women. But that reflects what I've seen in the emergency department for the last 25 years. Unfortunately, us guys would rather bury our head in the sand when we see that there may be issues down the road and not address it, and wait for a crisis, wait for the heart attack, or wait for the stroke, ignore the pre-diabetes. So women seem to be a little bit more insightful. I would say Patrick, in terms of the age group, is a little bit younger, because usually I see people that actually progress further than Patrick did with poor metabolic health, and they're more in their 40s and early 50s. But in terms of the lifestyle changes that he made, I see that often. Now, I'm not going to tell you it's 100% of people, but it's a very high percentage of people that once they understand, they understand the data, and they also begin to understand what has happened to us from a food intake standpoint as a country, again, over the last 50 years. I mean, they understand that, in the 40s and 50s and 60s, we weren't an obese and diabetic country. And so once people do a little bit of the research, and hopefully some of the information in the book helps related to that, they get it. So Patrick's approach is typical. His demographic, in terms of being a male and a little bit younger, is a little bit different, but you know, there's a big tent here. Everybody can come in. So I take care of teenagers too. You know, Patrick is a little bit younger, but you know, I take care of teenagers whose lives can be redirected. And then I take care of people at the other end of the age that are now in their 70s and realize they need to do something if they want to maintain their mobility and health long term. So again, I think everybody can participate in this approach.
Great. And just, I guess, maybe as one of our final questions here, because I see we're coming up on time, how much more difficult would it have been for Patrick had he waited, let's say, 5 more years, 10 more years before he decided to take action?
Yeah, I think there's always opportunity. There's always opportunity. The issue comes in when people get to the point where they can't be as physically active as Patrick is. You know, once you get a bad knee or a bad back, or you're so obese that the activity portion of it becomes more difficult. But even then, I mean, I have people that are not super older people that are not super mobile, but they can still do strength training. So you know, I think again, there's opportunity for everybody.
That's fantastic. Well, thank you guys so much for joining today. I think this has been super productive, and I've definitely learned a lot from my perspective. Patrick, congratulations again on your weight loss journey. I think, you know, losing, would you say it was 50 pounds?
Yep, just over 50.
In what was the time period?
10 months.
In 10 months. That's insane. So congratulations on that. Dr. Paul, thank you for joining the podcast here and providing the color commentary.
Yeah,
Ryan, did you want to?
I want to thank Patrick again for
Yeah.
being willing to share his story, and I also want to thank you guys. You know, I'm now sending my patients to the metabolichealth.com website because there's great information there. You know, and I remember just, you know, when you guys were just getting started, and the way the website has grown, and the information you have to offer, and it's spot on information that can help people again change their lives. So I want to congratulate you guys on your effort here as well.
Well, thank you so much. That means a lot coming from somebody of your caliber. Ryan, did you want to wrap us up with any other messages for our audience?
Sure. Echoing the thanks for our guests as well as the audience listening in. Want to mention the Continuous Glucose Revolution book that was shown during this call, written by Dr. Paul. You can find it on Amazon as well as many other major booksellers. I don't know if you want to plug any others in particular, Dr. Paul. But in addition, Dr. Paul's website's metabolicmds.com. You can get in touch with him if you liked what you heard today and you want to schedule a consultation. The states that he's licensed to practice in are Florida, Ohio, and then Indiana. And what's the fourth one, Dr. Paul?
Arizona.
Arizona. Okay. So if you're in one of those 4 states, you're in luck. And yeah, we just appreciate everyone's time, and we can't wait to see you next time on Reimagine Wellness.
Thank you.
Thanks, Ryan. Thanks, Mike.
Thank you.
Thanks, Dr.